So many thanks to David and Claudia for inviting me and for being just the best colleagues that one could ever have. My research support, including from the Prevent Cancer Foundation, thank you very much. So the point of my being here is to emphasize that radiologists can help reduce liver-related deaths by reporting liver steatosis when they observe this as a bonus finding. So just to make the point, when you do screening for lung cancer, the CT captures enough of the liver that it's possible to score for liver steatosis, which is the most common abdominal abnormality in asymptomatic people and an indicator of liver stress. The stress can be acute, as if somebody has just had burger and fries or they've had binge alcohol. That's not really a problem unless it leads to a chronic condition, which can cause up to 1.32 million deaths globally from chronic liver disease globally. Liver steatosis is often the first indication of liver dysfunction, so you really have an opportunity for early detection and prevention if you do note it in your radiology report. So we're here in Verona. Probably many of you are already contemplating what's in a name. Well, this has taken over the thinking of the hepatology community, and we just had a new nomenclature emailed out to everybody about a week ago. The old term for general fatty liver disease, non-alcoholic fatty liver disease, no more. There's a new umbrella term called steatotic liver disease. Now you can see from this number of professional societies that signed on, this was a considerable negotiation, not quite as complex as what Dr. Schmidt described to us yesterday, but still a long process, which has not led to universal agreement. The most common type of steatotic liver disease is going to be called metabolic dysfunction associated steatotic liver disease, and this is a condition that's associated with metabolic syndrome, but it's only one of any of a number of conditions that cause excess fat to accumulate in the liver. And for more details about subtypes under this new category, please check the AASLD website. And I just note that the Asia Pacific liver community has not signed on to this nomenclature, so there could still be changes. In the United States, MASLD is the most common type of chronic liver disease that one sees. It's about 52%. But alcohol, viral hepatitis are still highly prevalent. And one thing I want to convey is, although fatty liver disease or metabolic dysfunction associated steatotic liver disease is the most prevalent abnormality in the liver, it is not the most common cause of liver-related mortality. So mortality is still led by alcohol and viral hepatitis. So histologically, we grade the amount of fat in the liver from none, mild, moderate to severe. By histology, this is based on the percentage of hepatocytes that have macrovesicular steatosis. MRI is the gold standard for detecting fat in the liver non-invasively. And just to note that a low-dose CT scan detects moderate to severe steatosis. The presence of fat in the liver changes the attenuation. So from a normal liver with a high attenuation, you have a reduction to a lower attenuation, and the threshold is 40 Hounsfield's units to diagnose moderate to severe steatosis, which equates to about 30% of hepatocytes with macrovesicular steatosis. ARTIT, you can see, ask ARTIT for details, and colleagues here have developed a very efficient method for automatically diagnosing steatosis from chest CT scans. This algorithm performs very well compared to manual and has a high kappa score when compared to MRI for detecting liver fat. So I want to just mention what is the follow-up workup for diagnosis of steatosis as a bonus finding. According to the European Association, all individuals with steatosis, however diagnosed, should be screened for features of metabolic syndrome. This is independent of their transaminases, and in the United States, it goes a bit further. Patients with steatosis detecting on imaging should be screened for metabolic syndrome, alcohol intake, and please evaluate for other causes of liver disease, including viral hepatitis. We would like to have universal hepatitis screening, but we don't, so important to keep that in mind. This slide emphasizes injury types in the liver. Fat, which is white, is one type. Blue, fibrosis, is the abnormality most strongly associated with liver-related mortality, which is shown here. On the left, you see the relationship between the fibrosis stage and mortality, higher stage, greater fatality. Steatosis grade is not associated with mortality. So why did I say radiologists can help prevent liver-related death if it's not associated with mortality? And this is the answer. As liver disease progresses, the liver's capacity to manage fat decreases. So you may have a decrease in the content as fat as liver disease progresses. So it's very important to detect this early on. Just a reminder, the threshold is 40 Hounsfield for moderate to severe steatosis. There is no blood test for steatosis, so it's really important for radiologists to help us out. Please note it in your report. Just refer to GI, hepatology, or primary care for a follow-up workup. And I just so much want to thank my colleagues and the organizers of the meeting for just a wonderful experience being here. So thank you so much.